Ontario is increasingly looking to private sector to address staffing in healthcare, and new numbers show the costs are rising fast. Now, just last year, hospitals spent 4 times more on nursing agencies than they did in 2020, with the cost rising to $174 million. This is happening as advocates warn burnout and staff retention issues are getting worse in the public healthcare system. Joining me now with the thoughts is the CEO of the Registered Practical Nurses Association of Ontario, Dianne Martin. Dianne, thank you for being on the program. Appreciate your time.
Thank you so much for having me.
So let's make a start with this. Why is it that with the worst of COVID-19 seemingly behind us, staffing shortages are still persisting in our country?
Well, we asked our nurses that. Every year around this time, we do a survey of nurses to sort of see the trends in nursing. And what nurses told us is that 91% of them were experiencing still increasing workloads. So the ripple effect of what they experienced during COVID is continuing. 82% told us that they can't even get a day off for a family event or vacation. Feeling so overworked and frustrated. And so because it isn't solved, we are moving forward with a shortage that has no end in sight.
Yeah, those numbers are shocking. I mean, these are very high numbers we're talking about. Let's take a look at that. A recent survey found that 68% of nurses actually don't feel that they have time and resources, like you were saying, available to provide care to their patients. What kind of toll, Dianne, are these problems you've just described taking on our health system?
Our nurses tell us that what they're seeing is a lengthening of wait times, and 62% of nurses have actually witnessed a patient's health become worse directly because of the nursing shortage.
I want to understand, we've been discussing the story for a long time, especially during the pandemic, it worsened. How is it that whether it's the provincial government or the federal government, while they say it's a priority, things are not changing on the ground?
So I think that we're bringing in lots of nurses, right? We're bringing in lots of new nurses, but we are losing nurses, and those are the experienced nurses, at a much more rapid rate. We always knew that healthcare was going to cost a lot more at this time in history because of the aging population. That's been known for a very long time. But what we didn't know was what the impact would have on nurses who were limited in virtually no ability to negotiate a pay raise during the hardest years they had ever worked. And so there's nothing more expensive than a nursing shortage because, as you say, we start to pay up to 4 times as much to bring a nurse in from a nursing agency as opposed to having our own staff.
You know, I have some more numbers to share. So Canada added more than 53,000 healthcare workers in 2022, but job vacancies in the sector stood at 134,500 as of May this year. What needs to happen to resolve these issues?
So we have basically a list of things that need to happen. First of all, we have to have the government legislate a nurse-to-patient ratio. Nurses go to work every day, know what needs to be done, and are unable to do it, physically unable. They go home every day feeling like they have failed, and there's only so many times that you can do that as a nurse until you have to find the next thing, and it won't be 62% who leave say they leave the profession, not just leave their employer. The next thing that we think that has to happen is we have to create a career again that has a bright future, that can move forward, that people get into the profession, and because they love it and they can grow, they stay for life. We're not having that right now. We know that compensation needs to be appropriate for a profession of this stature. Indeed. And that's one of the things. Practical nurses, yes, there's been a raise, but it is not in the pockets of those practical nurses yet. So it's still a problem. And finally, we need to absolutely decrease our reliance or end our reliance on nursing agencies and have more full-time jobs built right into the organization.
Clearly a lot more that needs to be done, and thank you for taking out the time and speaking with us and highlighting the issues that we are facing in the country. Dianne Martin, appreciate your time. Thanks so much. Now, Lindsay has a new show.